DiGiulio, amputation of the fourth fingertip at the base of the nail, bone exposed.
How'd this happen?
I crushed under an air conditioning unit we were installing.
We'll numb up your finger. One shot will help with the pain.
Amazing.
Digital block, 3 cc's of Marcaine.
Pulse 110, BP 135 over 88 in triage.
Any drug allergies, sir? 2 grams of cefazolin?
Uh-huh.
Oh, wow.
Go with the block.
You ready? Mm-hmm. Pinprick and some burning. Where's the missing piece of skin?
It's, under a 1,000-pound unit. It's flat as a pancake.
Well, then we have nothing to reattach.
Plan, Dr. McKay?
Bone rongeur VY flap.
Exactly.
Awesome, I picked the right case.
Can somebody translate?
To close the wound, we're gonna trim down the bone, then use a plastic surgery trick so the skin will cover everything.
Okay.
Your finger's gonna be a little shorter, no nail.
Great. 10% off manicures.
Looks like they found you guys a new rig.
Nah, we Ubered.
Willie Alexander, 81, near syncope from the Memory Day Center. They said he's more altered than usual.
Pulse is 30, BP's 80 over 40. No change with a mig of atropine. He's got a pacer in his chest, but there's no capture.
How you feeling, Mr. Alexander?
Call me Willie. I'm fine.
Any chest pain?
No, ma'am.
Do you take beta blockers?
I take walks every day.
Only med is Namenda.
On my count. 1, 2, 3.
Pacemaker patient with dementia. Heart rate at 30, little altered with a systolic at 80.
What's your plan, Dr. Langdon?
Second mig of atropine now. Push dose epi 0.1 milligram portable chest.
31 on the monitor.
Dr. Javadi, what do you think of that heart rate?
It's not beta blockers, so junctional escape for them.
Exactly, common with a non-functioning pacemaker. Etiology, Dr. Mohan?
Dead battery or lead failure?
Indeed. Good squeeze, even if it is slow.
Atropine and epi on board.
What's next, Dr. Langdon?
We can try percutaneous pacing, but eventually you'll need transvenous.
Agreed.
Systolics up to 95 with the epi.
It's too low.
Let's start a drip, 2 mics per minute. Check the mental status.
He knows his name. Sir, do you know what year it is?
It's 20-something.
Do you know where you are?
Looks like a hospital to me.
Pittsburgh Trauma Medical Center.
Yep, I know this place. This Dr. Adamson's place. Where's he at? He working today?
How far down?
Just so the sub-Q will cover. You'll need to take a few days off work, sir.
Good, more time to study.
For what?
Master's degree, psychology.
No good.
Yeah. HVAC's just my day job. I went to trade school because I couldn't afford college. Now I can.
Good on the Roger.
Marking the surgical borders, 2 incisions.
Advance the triangle to cover the tip.
Until the V becomes a Y?
Exactly.
I guess you're the boss here?
Something like that.
Very good at teaching. Seriously, you step back and with a few words, you impart wisdom.
If you say so.
You mind if I ask what you do when you don't work?
Sleep. Now blunt dissect to undermine the tissue.
What do you think, Dr. Javadi?
3rd degree. Complete heart block.
Because?
AV dissociation. No relationship between the P waves and the QRS complexes. Clear.
Heart rate is 30. This low BP is going to make him a lot more confused.
Could cause a heart attack or a stroke if we don't fix it.
Oh. Well, mystery solved.
The wires aren't even touching.
I'm totally disconnected. Shit happens.
Heart rate still in low 30s, no change with atropine. Pacing pads are on.
We can try. Willie, your pacemaker isn't working.
We better fix it.
We're going to try to pace your heart from the outside. You might feel it in your chest. Let's start at 10 milliamps, rate of 60.
Pacer on.
Oh, twitch it.
No capture.
Increase to 20 milliamps.
That's more like a shock.
Still no capture.
Up to 30.
Oh, y'all trying to electrocute
Pacer off.
me?
Can't tolerate it.
Get rid of this shit.
Dr. Langdon?
One of Verse said, can we set up for transvenous?
I was set up before you got here.
Versette's on board. Willie, we need to float a temporary pacemaker from your neck into your heart.
Why is that?
Because your heart rate is only 30.
And hit me with a shot of atropine.
You've already had 3. Wait, are you a doctor?
He's out.